My name is Erin Witt, and today I'm doing a speech on salty cystic fibrosis, and this is my audience, my coworkers. A few years ago, I was lucky enough to work on a pediatric unit in Kansas in a really big hospital, and it was the first time that I ever saw and heard the term CF, which means cystic fibrosis. It was brutal witnessing it firsthand, and I first met these two little girls, Sophie and Malia. They were 6 months and 5 years old when I first met them, and little Sophie was about half the size of normal growth weight and was on a feeding tube, oxygen 24/7, and she wasn't reaching any of her milestones. Malia, at 8, had a double lung transplant, but Sophie wasn't so lucky. She ended up passing away from the illness when she was 4. Sophie, Malia, and the little children that I took care of were why I'm so interested in cystic fibrosis. Cystic fibrosis is a chronic hereditary disease that affects the respiratory, digestive, and reproductive systems, resulting in a painful life of respiratory infections, illness, and weeks-long hospital stays. Today I'll talk about the genetics behind cystic fibrosis, symptoms, and how they affect the body systems, testing for the disease, treatment and prognosis for someone diagnosed with CF. I look forward to sharing some interesting information with you today. The term cystic fibrosis refers to scarring and cyst formation within the pancreas. Cystic fibrosis is an inherited disease of the recessive CFTR gene that affects the secretory glands, which produce sweat and mucus. The CFTR gene, or cystic fibrosis transmembrane conductance regulator, is a protein channel that controls movement of salt and water in and out of cells in our body. People that have CF, without CF, have 2 normal CFTR genes. People with CF have 2 abnormal CFTR genes. If the CFTR gene is mutated at all or missing at all, it will result in CF. According to the National Heart, Lung, and Blood Institution, millions carry the defective CFTR gene, but they don't always show symptoms since they don't have 2 defective genes. These people are called carriers, and they can pass the defective gene onto their offspring. And if they only pass 1 defective CFTR gene, that child will become a carrier. If they pass 2, that child will have CF. Each parent has to pass down a CFTR gene that's abnormal for the offspring to have a 50% chance of getting CF. When there is a defect in these genes, it causes a thick, sticky mucus that becomes a breeding ground for bacteria. Mucus is present in our respiratory, digestive, and reproductive systems. In the lungs, it makes it harder for air to exchange across alveolus. In the digestive tract, it blocks enzyme supply from pancreas to the small intestine to properly break down and absorb fats and proteins. It blocks the liver and pancreatic ducts, which creates a very salty sweat. Thickening of the cervical mucus can cause infertility. Other issues arise, such as diabetes, pancreatitis, rectal prolapse from extensive fatty, greasy stools, weight loss, liver disease, gallstones, constant respiratory infections, pneumonia, lung collapse, pneumothorax, dehydration, and other reproductive complications. Later in life, it can cause low bone density and clubbing of the hands and feet due to poor circulation. When abnormal symptoms are noticed, it's important that proper testing is done immediately for early diagnosis of CF. Testing to find out if a child has CF, usually they'll find out before the child's 2 years old. They'll do a sweat chloride test to determine salt levels in the sweat, and high salt levels equal cystic fibrosis. They'll do labs to determine which type of chromosomal abnormality or defect is affecting the CFTR gene. They'll do x-rays, lung function tests, sputum cultures, prenatal screening using amniocentesis, and other carrier testing, such as different labs that will tell a person if they're a carrier or not. There are many treatments for the symptom control of CF, but there are no cures. Lung transplants can help, but they won't fix the other organs and the damage to the other organs. The disease will always still be there. Preventing and controlling lung infections is most important. People with CF and caregivers alike need to make sure that they are using proper hand hygiene at all times and using masks when necessary. Loosening and removing thick mucus using chest physical therapy, also called CPT, is important for CF patients. It includes pounding on the chest or back with a fist or with a clapper. They can also use a mechanical vibrating jacket that will shake them and loosen the mucus. And exercise is great for loosening mucus. Medications they will take vitamin supplements, high fat, calorie, and protein shakes, antibiotics, bronchodilators, which will dilate the bronchioles in the lungs so that you can breathe easier, and anti-inflammatories are also used. Oral pancreatic enzymes may be taken prior to meals, then they'll increase the absorption into the digestive system.
Oh, okay.
IV antibiotics may be needed for 10 days, 2 weeks, 21 days to clear up any respiratory illness. Feeding tubes may be required for substantial nutrition, and more severe cases may require constant oxygen and eventually a lung transplant. An article published on Cystic Fibrosis News Today discusses ibuprofen inhaled at high doses treating cystic fibrosis. They're working on a way to deliver it to the lungs directly without damaging the kidneys or the GI tract, because that's like the common problem with ibuprofen. But it has not been approved by the FDA, it's still being worked on. Living with CF is a daily battle, and prognosis is case by case. Cystic fibrosis is a chronic and sometimes deadly genetic disease. It may be relatively unknown, but it affects millions. Severity of symptoms always vary case by case. For a long time, children wouldn't live into their teens because of lack of control over symptoms and lack of understanding of the disease. With improving treatments and symptom management, people are living into their 40s and 50s. Early diagnosis and treatment is key to a longer, healthier life with CF. Thank you.